Hi, many people have pain in the outer or the lateral part of the elbow. Typically, this is also known as tennis elbow. As the name suggests, it may occur in tennis players, especially when they do a lot of backhand shots. However, it can also happen in any individuals who has a history of repetitive use and overstrain of the forearm extensor muscles. Example, you may have a history of opening and closing bottles or lifting heavy mugs or jugs, and this can typically cause pain in the outer part of the elbow. When you visit a doctor, there may be specific tests being done where when we strain this particular group of muscles, there is tenderness at a particular point on the outer part of the elbow region. Tennis elbow is rather common, however, it can be treated effectively. First of all, some amount of anti-inflammatory medications will certainly help to reduce the inflammation, because the underlying pathology would be either inflammation of the tendon or some degree of micro tears due to some underlying degeneration. Secondly, there is a big role of doing physiotherapy to strengthen and to stretch out this group of muscles. Thirdly, you may use some kind of supportive bands across the forearm, which would help to offload the stress on the common tendons so that the pain becomes less. With time, if all these measures are adhered to, the problem can be resolved and the symptoms would get better. Most importantly is to prevent such injuries by avoiding repetitive stress, which puts a lot of strain on this particular group of tendons. However, if you are involved in any particular activity, work, or some kind of sport which tends to overstrain this area, then it is advisable to use some kind of supportive guard whenever you are indulging in that activity. Take care.